it's amazing that, Marian went and started this, residency program because there is such a need for OBGYN physicians. And this is, part of the solution to address that need because, there are a lot of people who want to come and do this, but there aren't the spots for them. So with that, I'm going to let Dr. Yin talk a little bit more about why, we started this residency because she was so instrumental in that.
It's because I'm old enough to remember, I think. That might be part of it. First off, thank you all for coming. It was raining at 12:30, and I can't believe we have sun. So thank you all for showing up. I totally appreciate it. And before I forget, Mike, this whole place wouldn't look this great without his work and Bianca's wonderful work in getting this all set up. So I have to thank him. I had nothing to do with it. I will freely admit that. Oh, wow. So why did we start a residency program at Marian? Well, back to Mike. So I've been practicing for close to 20 years in San Luis Obispo. And Mike asked me, what do you want to do when you get closer to retirement or when you retire? And I said, well, we're going to have to move, honey, because there's no residency program here. And I know that when I'm getting close to retirement or when I retire, I'll volunteer and teach residents because it just sounds like it would be fun. Why I thought that, I have no idea. But amazingly, when I was in private practice in San Luis Obispo, we were looking to see if there was a need in Santa Maria for more OBGYNs. For those of you who live there, you probably recognize that that is true. And I started talking to Chuck Kova, who goes, we're building a brand new hospital in Santa Maria, and it's going to open May 2012. And by the way, Dr. Bailey, Dr. Merrill, and Dr. Oates have gotten approval for a family practice residency program that will start in 2013, and no one wants to teach the residents OBGYN because they have to do an OB rotation. They don't really like it. They have to do a GYN rotation. Some of them are interested, and we still are teaching them, but they're getting better. They're enjoying it now. And I said, okay, well, I can do that. So that's probably the reason I ended up in Santa Maria. Plus, we were looking to expand into Santa Maria. I think Sue remembers all of this. And so let me ask a question. How many of you have trouble getting into primary care or accessing your primary care physician? Okay, pretty much almost everyone. How many of you actually have trouble or have an OBGYN as your doctor? A lot less. That's how bad the shortage is nationwide, and that's how bad the shortage is in California. The most recent statistic that I saw that came out of the 2021 government study, and you know how good those are, says that nationally we will be short 5,160 OBGYNs nationally. In the state of California, we will be short 1,160 of them. 1/4 of the shortage will be in the state of California. Because of the high cost of living, we all know that's true. And because we don't have enough residency programs. So after the family medicine residency program got started, what people don't realize is the governing body determines how many residents a hospital can have. And ACGME decided that Marian could accommodate 30 residents total. So we have 6 family practice residents a year for 3 years. That's 18. That leaves 12 spots left. And you have to fill them by 5 years out, or you don't get to fill them at all. So the question came up, well, do we expand the family medicine residency program to 10 a year, right? Because that'll get you your 30. Or do we start another residency program? So Dr. Shields, Dr. Oates, and I kind of did a lot of talking, and when we realized what a shortage of OBGYNs we would have, we're like, can we do this? Definitely, as everyone knows, we have plenty of obstetrics in Santa Maria. No shortage of OB care, no shortage of deliveries and experience for our residents. But do we have enough gynecology, oncology? Because what people don't realize in OBGYN, you have to have all these subspecialties that need to be available. So in 2014, Dr. Labed showed up so we could do urogynecology. We cobbled together reproductive endocrinology and infertility because we have doctors in Santa Barbara and doctors in San Luis Obispo. And the administration recruited a gynecologist oncologist in 2016. So 147 pages, because I had to write some of it, so I know how painful that was. I had to hand count the GYN procedures by hand because there was no computer program to do it. Jasmine, you're going to have to work on that. It had to be done by hand, but it turned out that we had enough procedures and enough learning opportunities so we could do an OBGYN residency program. And so the ACGME saw, or the Residency Review Council, I forget the name of it, decided to approve our program in April of 2017. And here we are. And we have these wonderful residents. And what we need now is we've outgrown what we have. And we need to build a freestanding residency clinic so that we can continue this legacy of recruiting and training these young minds and having them stay here so they can take care of me when I retire and all of us, because obviously we need more of us. Okay? All right.